This is the final training session. At this point, you should have completed Training 1, the AAP ADHD Guideline Training, Training 2, the Mental Health for ADHD Training, and Training 3, in which you develop an ADHD office flow. This final presentation will focus on two general topics aimed at maintaining your performance. The first topic is billing and coding for ADHD services. The second topic will focus on using quality improvement strategies to improve and maintain ADHD practice behaviors at your office. We will begin with a brief presentation that provides offices with information about the use of optimal billing and coding strategies for ADHD care. We have found in our experiences with primary care providers that there is a tendency to underbill for ADHD services. This presentation will detail billing patterns that have worked for many offices who have participated in using mental health for ADHD. There is a lot of technical information in this presentation. Therefore, we have developed a summary of this content and placed it in our knowledge base, which is accessible through the Help tab in the Mental Health for ADHD application. This document is named ADHD Billing and Coding 101. Assessment of ADHD takes time. Physicians need to bill for the amount of time they spend conducting the ADHD assessment. For an ADHD assessment visit that takes 25 minutes, a 99214 coding should be used. If it is an ADHD assessment with complexities, such as multiple comorbidities, the visit may take longer. For a visit lasting 40 minutes, it is possible to use the 99215 coding. There are also situations where a physician is meeting with a patient for another indication or for an annual checkup and ADHD is raised by the family. The 25 modifier code can be added to the visit to allow for additional payment for the discussion of ADHD. We have found that a majority of insurance carriers recognize and pay for this modifier coding. Physicians also need to bill for the collection of ADHD rating scales during the assessment process. Rating scale collection is reimbursed by almost all insurance companies, including Medicaid. The appropriate code to use for the collection of an ADHD rating scale is 96110. If multiple rating scales are collected, for example from the parent and a teacher, multiple 96110 codes can be used. However, each subsequent 9611 code must include the 59 modifier. Reimbursement rates per rating scale range from $13 to $25 depending on the insurance company. When using these codes, it is important to include chart documentation about the diagnostic information used from the rating scales. This may be the number of ADHD symptoms endorsed by parents and teachers, or noted areas of impairment. Note that the interpretive reports from the Mental Health for ADHD can be included in the charts as documentation of the use of the rating scales during the diagnostic process. Just as physicians need to document their use of the ADHD rating scales, physicians also need to document their assessment visit activities in order to justify the billing code utilized. There are several elements of documentation that need to be present in a physician note to justify the reimbursement. For an assessment visit, the physician needs to document the review of medical, developmental, educational, social, and family histories. If a physical and/or mental status exam is completed, this also needs to be documented. Physicians should also document their interpretation of rating scales, differential diagnosis, treatment plan, and plan for follow-up. Finally, documentation of the time spent with the patient, along with an estimate of the percentage of time spent educating and counseling family, is useful in documenting visit content. For follow-up visits, physicians will need to code according to time spent during the visit similar to assessment visits. If 15 minutes or less are spent on the follow-up visit, a 99213 code is appropriate. However, if a visit lasts 20 minutes or more, it is appropriate to use a 99214 code for the follow-up visit. Also, if a discussion regarding ADHD treatment occurs within the context of another visit, such as an annual checkup, the 25 modifier should again be used. The most relevant billing item that is affected by use of the application is billing for the collection of ADHD rating scales as part of treatment monitoring. Recall that the AAP guidelines suggest that physicians collect parent and teacher Vanderbilt scale weekly during titration and every 3 months during maintenance. Each ADHD rating scale collected during titration and maintenance can be billed as a 96110. Remember to use the 59 modifier when billing for multiple ADHD rating scales at the same time. Again, billing for these rating scales can earn revenues of $13 to $25 per rating scale. Just remember to document in the chart that the rating scales were examined by the physician and used for clinical decision-making. The interpretive reports from Mental Health for ADHD can be used as documentation. Many of the practice behaviors promoted by the Mental Health for ADHD application involve telephone and email communication with patients. While insurance companies are variable in the reimbursement for these communications, these can be billed for using the 99441, 99442, and 99443 codings for telephone calls between physicians to families, and 98966, 98967, and 98968 codings for telephone calls between medical staff and the family. The content of the calls need to be documented in the chart. Also, no ADHD-associated office visits can occur during the 7 days preceding or the 24 hours following the phone call. Finally, physician emails to the family can be billed using the 99444 coding, and clinical staff to the family emails can be billed using the 98969 coding. We believe that if offices use the billing and codings recommended in this brief presentation, physicians will begin to receive reimbursements that are more fairly approximate the amount of time and effort that goes into caring for children with ADHD. Remember that you can access a summary of the information presented in this presentation through the knowledge base.